Hi students, welcome home to Mars. Today we shall discuss about clavicle, the bone of the upper limb placed here between the neck and the pectoral region, and this is the only bone which connects the entire upper limb with the axial skeleton, that is the sternum. This is the commonly fractured bone in the body, and if clavicle fractures, then the entire upper limb will sag like this, and the patient has to hold that upper limb with the opposite hand. Now, before we describe the clavicle in detail, first let us see where it is positioned in our body and what are the structures related. So, here is the clavicle located between the root of the neck and the trunk. The muscles here are, this huge muscle is pectoralis major. This muscle of your shoulder region is deltoid. This muscle which helps you to rotate, turn your head, this is sternocleidomastoid, and this muscle which helps you to shrug or lift your arm above the head, this is trapezius. So, these are the muscles in this region. The next thing that you should know is, just behind the clavicle and beneath the clavicle, these are the subclavian vessels and the trunk of brachial plexus. If the clavicle is fractured, these are the structures which will be injured. And the third thing that we should know is, this is the coracoid process of scapula and this is the clavicle. Between the coracoid process of scapula and the clavicle is the strongest ligament of the upper limb. This ligament is coracoclavicular ligament. And between the clavicle and the first costal cartilage, there is one more ligament over here. This is called as costoclavicular ligament. So, before we start off describing the clavicle, these are the parts which you have to keep in mind. Now, let us pick up the clavicle. The clavicle that I am holding now is of left side. Why? Let us first see the parts. Clavicle has two ends. This end, which is more quadrilateral in shape, this is the medial end of the clavicle. It articulates with the notch present on the manubrium. This is the part of your sternum. So, this joint that is formed, this is called as sternoclavicular joint. It's placed over here. So, this is the medial end of the clavicle or sternal end of the clavicle. This flattened part, this is acromial end of the clavicle. It articulates with the acromial process. There is a facet on the acromial process. So, this joint that is formed, it is acromioclavicular joint. So, apart from the two ends, it has got a S-shaped shaft. So, you can see it is S-shaped, because of which this middle third of the clavicle is the weakest part, and that's the common site of fracture. So, now, how to hold it in anatomical position? The quadrilateral shaped sternal end should be facing medially. Flattened acromial end should be facing laterally, and the shaft should be convexo. That means towards the medial end, it is convex anteriorly. That means medial 2/3 is convex anteriorly and the lateral 1/3 is concave anteriorly. So, the students usually ask, okay, then I can hold the clavicle this way also. Why can't you hold it this way? Because Look at the under surface of the clavicle. This is the inferior surface of the clavicle. This inferior surface has a groove. This groove is called as subclavian groove. This subclavian groove should be directed downwards. That's why this becomes a left-sided. Now, you being a viewer, you want to know how you will hold it. So, for your left side, it would be like this. I'm holding it for your left side. So, this is sternal end. This is acromial end. Convex, medial 2/3 anteriorly. Concave, lateral 1/3 anteriorly. So, you call the shaft as convexo-concave. This is the way you hold it in anatomical position. Got it? Now, once you hold it in anatomical position, we have to describe its attachments. Let me tell you one thing. This medial 2/3 is quite rounded, and you just think that it is like a crowded city. So, you have more muscle attachments there and more relations to structures over here. When you go to the lateral end is like the beach side, flattened, cool. There are just two muscles attached over here. Now, we shall start with the cool lateral end. That's the flattened acromial end. See, just look at the bone. This part is the superior surface. No muscle attachment, nothing to worry. This part is the inferior surface. On the inferior surface, you have a tubercle. You can see the tubercle here. This is conoid tubercle, and from there is a ridge passing laterally. This is trapezoid ridge. To this, very important, strongest ligament of your upper limb called as coracoclavicular ligament is attached. See, it's held like this in our body. So, the coracoclavicular ligament is here. This is coracoid process of scapula. This is conoid tubercle. This is trapezoid ridge beneath it. So, the coracoclavicular ligament is present over here. Now, this border is anterior border. So, which muscle is attached? You saw it in the previous picture. Your deltoid is attached. Your anterior fibers of deltoid is attached over here. They are so important because that is helping us to flex our arm, helping us to medially rotate our arm. This is deltoid. And to the posterior border here, trapezius is attached. Right now, if I have to shrug my shoulder or if I have to just lift my arm above my head level, it is because of this trapezius attached to the posterior border. Trapezius is located here. Now come to the medial 2/3. For the medial 2/3, this is anterior surface, and just now you saw in the picture, you have the pectoralis major attached here. Which fibers? They are called as clavicular fibers of pectoralis major, a muscle that will help to adduct your arm, medially rotate your arm, flex your arm. That's your pectoralis major. This is superior surface. Just now you saw, here is sternocleidomastoid. That's attached over here. If you have to lift your head from the pillow every day, it's because of bilateral contraction of sternocleidomastoid, and that's attached to the superior surface. To the posterior surface, no muscles are attached in particular, but just now you saw very important structures will pass beneath it. Subclavian vessels and trunks of the brachial plexus. If I have to be very precise, the divisions of the brachial plexus lie behind the clavicle. That's a very important posterior relation, which you should remember just not for your exams but forever, because when the clavicle fractures, these vessels will be injured, this trunk will be injured. Then come to the inferior surface. You can see the groove over here. This groove is the subclavian groove, sub below. Clavian means clavicle. So this is the subclavian groove, to which subclavius muscle is attached. Very small muscle present just below your clavicle. It helps to stabilize. See, right now, if you have a doubt and you imagine you're in my class and you're raising your arm, asking for a doubt, you're just raising. And at that time, who stabilizes your shoulder joint? It is because of a small muscle here, subclavius muscle. Also, sometimes there's a muscle in your head and neck, sternohyoid. Partly gets attached to this inferior surface. So these are the muscle attachments and the ligament attachments of the clavicle with the relations. So what we have studied just now, we can actually quickly draw a diagram so that you can revise what you have learned. So you can draw along with me. I'll draw two views. First, the anterior view of clavicle. This is the anterior view of clavicle. So let us draw one clavicle, convexo-concave. So this is convexo-concave. So now we understand that this is medial or sternal end of the clavicle, and this is lateral or acromial end of the clavicle. Then we will draw one more view, the inferior view of clavicle. This is the inferior view of clavicle. So over here, this is how it goes, sternal end, and this is the clavicular end. Now, this is the sternal end, which you can also call it as medial end, and this is acromial end. You can also call it as lateral end. Both means the same. Now, we'll quickly draw the attachments over here. So, to the anterior surface, this is pectoralis major, pectoralis major. This is to the superior surface, sternocleidomastoid muscle. So, this is sternocleidomastoid muscle. Coming to the lateral end, here to the anterior border, deltoid is attached. So, this is deltoid, and to the posterior border, trapezius is attached. So, this is trapezius. Now, we also know that on the inferior surface, there is a groove, and this groove is called as subclavian groove, to which subclavius muscle is attached. So, this is subclavius muscle. Subclavius muscle. Now, to the two lips of subclavian groove, clavipectoral fascia is attached over there. Apart from these 5 muscles, occasionally we also have the attachment of sternohyoid muscle towards the medial end. The 2 ligaments which are attached are the conoid part of coracoclavicular ligament, and this is the trapezoid part of coracoclavicular ligament, and towards the medial end, this is our costoclavicular ligament. So this is a quick revision of the clavicular attachments. Last part, the clinical anatomy. As we previously discussed, clavicle is the commonest bone to be fractured in the middle third, because this is the weakest point of the clavicle, because 2 curvatures meet at this point. So when the clavicle fractures here, the subclavian vessels and the trunk of brachial plexus will be affected. Another point is, Clavicle is the first bone to form in our body, that is somewhere in 5th or 6th week of intrauterine life, and this is the last bone to complete ossification. Usually all long bones develop in cartilage, but clavicle has membranocartilaginous ossification, so absence of medullary cavity. It's the most subcutaneous long bone, also pierced by supraclavicular nerve. Now, a clinical condition where the two parts of the clavicle, if they fail to fuse, then that condition is called as clavicular dysostosis. And there is one more clinical condition that is called as cleidocranial dysostosis, which means partial or complete absence of clavicle. So this is about clavicle, and it is Mars where medicine meets meaning. Please share your valuable comments so that I can improve my class further. Thank you.